Hello, doctors. My name is Dr. Jasmine Prajapati. I'm gonna teach you some stuff related to microbiology, and we will start from the basic topic we called fungi, mycology, and we will learn today the basic mycology, what are the cultures used, and superficial mycology. There are three types of superficial mycology we will learn today. Okay. Our first topic is the superficial mycosis, right? But first we learn about the basic fungi. What are the basic fungi? Okay. There are actually four types. Okay. Remember, four types we call. Okay. First one, first one is the yeast. Okay. First one is the yeast. How they look like? They look like the big round and the small one. We called it like sphericals. Okay. There are three types. There are the three type of yeast. Okay, which one? So we know cryptocurrency, right? Cryptocurrency. So yeast are like the cryptocurrency. They look like the crypto. See here. Okay. See here. Okay. This spherical, right? So spherical shape, we called it yeast. Okay. There are three types of uh, cryptococcus, right? They are round. So what we called them? Cryptococcus, right? Second one is rhinosporidiosis. Second one is rhinosporidiosis. And third one is saccharomycosis, right? Why we named like this? The crypto, rhino, and saccharome. Okay, crypto, rhino, and saccharome. In that part, the cryptococcus is the opportunistic infection. That's why we written here is OP. Okay, they are OP. So opportunistic infection. What are the opportunistic infection? Which happen in the HIV or AIDS or immunosuppression condition, right? Okay. Second one is the yeast like. What is the yeast like condition, right? Okay. So yeast like conditions are there are like two. Okay. Isn't that look like the can? Okay, they look like yeast like. Okay, yeast like what like means they look like yeast. Okay, so there are mainly two types we will remember is one is can for candida and second one is P0VC. Okay, the both are opportunistic infection. Both are opportunistic infection. And the third one, which is the Malassezia. 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 There are two types, Malassezia globosa and Malassezia furba. Okay. What we have written here is the superficial. Means they causes superficial fungal infection, which we will gonna got study, right? Okay. So can PG and Mala. Can PG la Mala. Okay. Okay. We have to remember how we will stain them. Okay, so basically we will stain with gram stain. How we will stain? Gram stain. Okay, the third one, the type is we called it molds. Molds. Okay, there are two type of molds. Okay, we will call it hyphae. Okay, two types. One is septate and second one is aseptate. Okay, first one is the septate, second one is aseptate. Okay, the aseptate types, there are three types. Which one? Rhizopus, Epsidia, and Mucor, right? So all together we called it mucormycosis, right? We all together called it mucormycosis. RAM, Rhizopus, Epsidia, and Mucor. Second type is septate. Okay, They are acute angle branching or irregular branching. What are the meaning? Acute angle means at some angle, right? Irregular means any angle. Okay. So A for aspergillosis and irregular are our favorite dermatophytes. Okay. Second name is Tinea cis. Okay. Third name is ringworms. Right. So in HYPHE type, there are molds, HYPHE, aseptate and septate. In aseptate, there is RAM. We called it aseptate mucormycosis. RAM. RAM means Rhizopus, Epsidia, and mucor. Right? Septate type are two types, acute angle and irregular. Right? We called it aspergillosis, acute angle branching, and irregular branching are dermatophytes, tiniasis, or ringworm. Right? In these, the aseptate mucormycosis and aspergillosis both are the opportunistic infection. That's why we have written OP. And what is this? Dermatophytes are superficial infection. Which other one is superficial infection is Malassezia, right? And the third type is dimorphic. Dimorphic means at two different temperature there are two different species. Okay, at two different temperature there are two different species. Okay, what does that mean? What is the normal temperature of our body is 37 degrees Celsius. So in 37 degrees Celsius they look like yeast. Okay, so if they come into our body is like goal, round. So at our body temperature, it's like 37 degrees Celsius yeast form and 25 degrees Celsius means right now my room temperature. They looks like the mold, hi-fi. Okay, these walls are like hi-fi. Okay, understand? So at the room temperature, 25 degrees Celsius, it's the hi-fi, and our body temperature 37 degrees Celsius is like yeast. Okay, okay, how we will remember that? Okay, histoblasto. What is the histoblastosis and blastomycosis? Right, histoblastosis and blastomycosis. Second is coccidiomycosis and paracocceidiomycosis. Now these four are systemic or endemic. Systemic or endemic. What is the meaning? They infect our organ, mostly our lungs. Right? Okay. The third category is Sporothrynx pankies. Okay, Sporothrynx and penicilli or Telleromyces. Those are the deep mycosis. Deep mycosis matlab subcutaneous infection. They invade the skin and involve the lymphatic systems and our deep connective tissue, right? So, if we want to stain our hyphae, right? How we will stain? We will stain it with LPCB mount, okay? LPCB mount, okay? And we culture on it with SDA agar, Sabor dextrose agar. Which agar? Sabor dextrose agar. If they ask how we will culture on which agar, SDA agar, all the fungi, right? How we will grow hyphae or the mold or the dimorphic fungi at the 25 degrees Celsius. So LPCB mount. How we will see the yeast and yeast like fungi, gram stain, right? So easily remember this topic. Okay, this is the basic stuff. If you remember the basic stuff, you can solve so many MCQ and you can write. Okay, you can take a screenshot if you want of it. Okay, okay, histo, blasto, coccidio, paracoccidio, sporothrix, and penicilli mycosis. Right now, we will go towards the our next topic is superficial mycosis. Right, superficial mycosis. Our first topic is tinea or the pitriasis versicolor. Okay, now I will show some images. Okay, what you are looking at it, what you are looking at it. This is, you can see some hypopigmented patches. Okay, you can see some hypopigmented patches, right? Okay, so what is the meaning of the pitriasis or the tinea, right? So versi means versi means various, color means color. Okay, patriasis, other meaning is the all over body or upper body, right? Are you getting it? Okay, what is the meaning of patrias? Patrias mean turning. So turning various color, which color? Hypo and hyperpigmentations. All you understand? Hypo and hyperpigmentation. So you can see on upper body this type of all the hypo or hyperpigmented patches. Okay, by which organism is this happen? Is Malassezia globosa over the furfur. Okay, why globosa is more common? Because it's globally, so globosa is the more common. Malassezia globosa, and second one is furfur. Okay, if we have learned, what we learned is the SDA agar. If we grow SDA agar, how we will can see is the fried egg colonies. Okay, fried egg colonies. Okay, and if we will culture, how they look like, what is this, what is this? It is the spaghetti and meatball appearance. Spaghetti and meatball appearance, you can see the small meatballs with the spaghetti. These are the spaghetti, right? These are the similar to spaghetti, and this one is meatballs. Okay, okay. And what are the differential diagnosis? First, we will see the woodland. Okay, they look like golden, yellow, pteridine pigments. Okay, so if you want to remember few words about this tinea or pityriasis versicolor, they are hypo or hyperpigmented, Malassezia globosa and furfur, fried egg colony, spaghetti meatball appearance, and golden yellow pteridine pigments. Okay, some other differential diagnosis, which are some other differential diagnosis, are are pityriasis, pityriasis, alba means white. Okay, rosea, rosea means rashish, which happens due to HHV6 and 7 infections. What are the others? Okay, it's like seborrheic dermatitis, right? Erythema, okay, vitiligo, okay, and many more. Leprosy, syphilis, okay, but we will not remember all. We have to just distinguish it, right? How we will treat it? Okay, how we will treat? So we will use topical azoles. Which are the topical azoles? We know, okay, ketoconazole, miconazole, then clotrimazole, and what is the other things we can use? Okay, if they involve hair, we must shave because they involve the infection, right? So now everyone knows. Now, some other points I want to tell about is where we can see this fried egg. Okay, we also seen in Mycoplasma and Moraxella. Okay, about the colony. And this fried egg word, where we can see, is oligodendroglioma, right? So we have to remember these things here itself. Okay, the five things: Malassezia globosa, fried egg colony, spaghetti meatball appearance, golden yellow pteridine pigments, and topical treatment. Right? There are second infection. PIEDRA. PIEDRA means nodules. PIEDRA means nodules. There are two types, white and black. Okay, the black people are hot. So what is the organism? Is Piedria horti. Okay, Piedria horti. And what is the white? White, its name is Trichosporon beagley. Okay, they give creamy white colony. Okay, and they will give brownish colony, right? Our third and most important infections is dermatophytes. The other name is tiniasis. Remember, this tinea is different from the tiniasis. Okay, ओके टीनियासिस टीनिया हम क्या करते हैं चाय पीते हैं ठीक है तो चाय पीते हैं तो खाने की चीज से क्या होता है टी सोलियम एंड टी सेजिनेटा ओके those infection are related to this tiniasis right but we are learning is TINEAS okay tinea which we call is dermatophytes and ringworm. Everyone have seen ringworm, this annular type of region, okay, circumferential. These are the common. Okay, I have just taken up the pictures from the Google, so you can see the different type. You have seen these pictures from the ringworm ads. Okay, these are the some type are like resistance type of the or because of the steroid use. Okay, so first we will see is this is so with the specific area we will call something it. Okay, we will call it this is the growing area, right? We will call it Tinea cruris. Okay, crur, but they will never involve scrotum. They will never involve scrotum. Remember these things. Okay, they involve the groin area, they involve all the groin area, but they never involve the scrotum. Okay, this is the most important thing. Okay, second important thing is they are more common with the male. Okay, okay, we can spread it to our partner. Okay, so this is Tinea unguium. The other name is onychomycosis, right? Onychomycosis. Okay, thick tunnel discolored nail plate with the onycholysis, right? They are mostly yellow colored. Which colored? Yellow colored. Okay, this is the which area? Pad area. Okay, we will call this Tinea padis. Okay, they are because of the okay most the common symptoms are the itching. Okay, okay, round area. Okay, in food most of because of the use of the socks, bathing, swimming pool use. Okay, climate changes, warm weather. Okay, this is the Tinea corporis. Tinea corporis. Why they given the word corporis? Because corporate, corporate, common, common, okay, common thing. So in our common area, okay, upper body, lower body, outer body, forearm, all this area are the tinea corporis, okay, annular lesion, okay, ring type lesion, body area. So corporis for the body area. Okay, our next, and there are the simple symptoms are itching, burning, rashes. They are most common patients we have seen in the OPDs. Okay, and like what we can do for the diagnosis is the skin scraping. We can see this microscopy. We will see. Okay, biopsy and the culture. We have already studied that part. Okay, now where this infection dermatophytes we will see the three area. First, skin, second, hair, and third, we have seen is the nail. Okay, so according to that, we have just given the part. But first, we will learn the tinea capitis, the most important topic of the skin and the micro. Okay, tinea capitis. Tinea capitis, capitis matlab skull. Okay, skull area, hair area, right? So, what they cause? They cause the alopecia. Alopecia. Okay, they cause alopecia. There are two type of alopecia. They cause is non-scarring and the scarring. Okay, the non-scarring or non-inflammatory type. There are two types. Okay, there are two types. Which two types? Which two types is? First is the ectothrix and second one is the endothrix. Okay. First we will learn the microscopy. Okay. First we will learn the microscopy. The basic microscopy is we have already told you is the involvement of hair, nail, and skin. Right? We will written it like H and S. Okay, H and S. Right? So what is the meaning of tri? Tri means trichophyton, microsporon, epidermophyton. So in in trichophyton, the all three organs are involved: hair, nail, and skin. Right? But what is the micro thing? Micro things are our hair. So hair plus skin, no nail involvement. What is the epidermo? Okay, the epidermo, the dermal area, which is the thing, is nail. So nail plus skin involvement. Okay, there are the two types of things. It's the microconidia. Okay, microconidia, the abundant microconidia. Why? Because of the hair and skin both involvement. Okay, hair and skin both involvement. There are abundant. Here are the less number, means fewer numbers. Here the absent. Okay, why absent? Because in there are no hair involvement, so no microconidia. Okay, in macroconidia they will look like this. Okay, the trichophytons look like the pencil shape. You can see the pencil shape. If I draw like this is the pencil shape. Okay, and they are the sorry. They are the unicellular. They are the unicellular. Okay, they involve all three organs, but they are unicellular. Okay, these are the spindle shape. Okay, which shape? Spindle shape. Which one? Microsporum. Hair involvement are the spindle shape. Okay, spindle shape. And this one is nail involvement. They look like this. We call this club shape. Okay, club shape because of the nail involved. So it isn't that look like the nails. Okay, the club shape. Easy to remember. Okay, all three species are involved like the pencil. Okay, all three species are involved like the pencil, and the microsporum is Which one? Microsporon is spindle shape. Okay, we have to remember the hair. If we bundle up the hair, it's look like the spindle shape, right? Okay, okay, good. If if we do a wood lamp examination, if we do wood lamp examination, we can see the microsporon positive, but the trichophyton is negative. Okay, if you get it in the question, remember this. Okay, now we these both are the multicellular. Okay, multicellular, right? So our we will come to the point our tinea capitis. Okay, skull area. Okay, they called arthrospores, right? Okay, there are two types, ectothrix and endothrix. What is the meaning of that? Okay, ectothrix and endothrix, right? If they are, if they are inside, we will call it inside. Inside means endothrix, okay, and ectothrix means outer side, okay. If we will see, okay, we will see these are the outer side area, okay, gray patch. So we will call it ectothrix, means outside, means gray patch, okay, or this one is endothrix or inside, okay, inside. If we, okay, these are the broken heads, okay. If we do KOH mount, if we do KOH mount, okay, what we can see? We can see the species. Which species? We have to remember. If they are the endothrix, okay, if they are the endothrix, okay, the endo, they are involved in skin all three, okay, they are the trichophyton, tonsurans, and or violaceous, right? And here one, the gray patch or the ectothrix are the microsporon because they are involved inside the microsporon or bini or canis. Remember, guys, canis mean pads involvement, right? This one question is asked earlier, so remember this. Okay, so canis is the most common type. Okay, if we do wood lamp, okay, so which color? Sorry, if we go for the KOH mount, which color we can see in this, right? So violaceous means purple. Violaceous means purple color. Tonsurans mean yellow color coloring. Okay. Microsporum odini or canis means we will see gray color, grayish white color. Okay. The scarring alopecia, there are two types. Okay. Scarring alopecia, there are two types. Which one? Which one? Okay. These are the bogey type lesion. Okay. And this is the scapula or the cup-like lesion. Okay. So we will call it carrion, and this one is favus. Okay, cup space. Okay, which are the species? So this is the like verrucous lesion. So it's trichophyton verrucosum, right? How they look like? They look like green fluorescence, right? And here one is Trichophyton scolani. Okay, scolani. Scolani sh scutula, cup-like scolani. They look like which color? Dull blue color colony. Dull blue color colony. Okay, they look like this. Okay, so this question is asked in 2022 exam. Okay, favors is because of the tease colony, scutula, cup. Okay, favors they all are the same. Boggy lesion, carrion. Okay, verrucous lesion, so varicosum, right? Ectothris, outside. Outside, what is outside? Is the microsporum, ordini or the canis. Gray patches outside. We can see outside. Outside we see pets. Which pets? Canis. Okay, microsporum, ordini or the canis. Okay, endothrix, inside. It's a broken hair. Okay, black dots or the white dots. Okay, which trichophyton? Tonsurans. Okay, or the violations. They break the rule. Okay, violations is the purple. Okay, and the other one thing we have to be remember is the nail part. Okay, nail that is called trichophyton rubrum. Okay, rubrums means red color. Okay, red color. They see KOH on a white colony. They have both micro plus macro conidia. Okay, like this. Okay, but when we have to distinguish with T mentagrophytes, how we will distinguish? By hair perforation taste, right? This is also a PYQ. This is also a PYQ. Okay, these are the septate irregular. Okay, so now when we talk about the treatment, generally Tinea capitis, we use griseofulvin, right? We use topical. We know which are the topicals. Okay, if we talk about the treatment, we always use topical plus or minus systemic, right? Which systemics we use for 2 to 4 week is fluconazole, okay, or the itraconazole, right? These both are we using. In the topical, which one we use is mostly ketoconazole. Now new one is coming is miconazole, luliconazole, and the clotrimazole. Okay, this one we use 8 to 12 week. If we don't continue this will come again and again and again, and it will become the more resistance with the time. So this is from my side. Three most important topics: superficial, okay, tinea, pityriasis versicolor, okay, PIEDRA, which is not much common, and this is the most common they ask in the exam of university and the NEET PG or the FMG or the IELTS exam. Okay, dermatophyte, TINEASIS, ringworm, okay, in detail, Tinea capitis, okay, all the lesion and the species and the microscopy, okay, and we have also talked about the fungi, the basic fungi concept. Okay, so if you like this video, please share, subscribe, like, and comment your views. How can I improve with this or any other things, or which topics you want me to teach? Okay, with the good small mnemonics, so how you can remember it easily. Okay, thank you so much. Bye bye.